Good morning, everyone, and happy Friday. I would like to call the Durham Recovery Renewal Task Force meeting to order. And I'm going to start by asking a very simple question. Does anybody know what this Sunday is? It's not a holiday, but this Sunday actually marks our 100th day of being together as a task force. So want you all to celebrate this Sunday because we've done a lot of great work over the last 100 or 90-ish days. And in celebration of this upcoming Sunday, since we won't be together, Katie and I got up really early this morning and baked some virtual treats. Here they are on the tray. Use your imagination. It's your favorite treat, so just imagine we just sat them on your table, on your desk. So feel free to partake in any of the treats that you like. Katie even ground some gourmet coffee this morning. So grab you a cup of coffee and enjoy the meeting. But again, just want to say thanks for all the great work. It's been a great 100 days, or the Sunday 100 days since we've been together. We've accomplished a lot, and certainly looking forward to all the great work that we're going to do between now and May. So with that said, I will turn it over to Mayor Schul and Chair Jacobs for their updates.
I think, Wendy, is it your turn to go first? My turn? Okay, I'll go first then. Good to see everybody. 100 days, and you know, I feel bad because I'm looking at Phil and Pilar and George and Jody, and we told you it would be 100 days, and it turns out it's going to be a lot more than 100 days. But thank you all so much for what you've done so far and your commitment to stick with it. It's really great. Let me just say that we've got somebody who's Zoom bombing our chat. So just want to point that out to Amber. I don't know if there's anything we can do about it, but if not, we'll just live with it. So I just want to talk about a couple of things from this, the last week. We, as usual, a lot of great work was done this past week, and I'll try to just hit a couple of the highlights. I know that you all continue to be interested in the funding of the task force proposals. The city is funding half of the Health Ambassadors program. I know the county is planning to do so as well. Our commitment, I think, is around $330,000. The Safe Passage program for the masks and dispensers we're funding as well. That work is well underway. And the communications plan, our funding commitment is roughly in the $120,000 range, 115. And the risk mitigation fund, the council is very interested and very supportive. We have a couple of, the council, as did the county commission, had questions about that and concerns and ideas about how we can improve that proposal. Including the creation of a warehouse for the important PPE that people need, businesses need rather. And there's a lot of good work going on around that now, trying to figure out that warehouse concept as well as providing grants. And so the risk mitigation fund is still a lot of work going on around that, which is great. The community engagement team, Lois and Amber, pulled us together. Thank you, Lois. And thank you, Amber, very much. And it was a very good meeting. Pilar was there, Constance Stansel and Linwood Best from our neighborhood improvement services were there. Ryan was there. Quelly from Durham County was there. The racial equity officer in Durham County, as was Sharon Williams, the racial equity officer for the city. There may have been a couple of others there that I've forgotten, but it was a very good group. Had a great discussion, and it was a really discussion about how to hear the voices of our own community. Especially, we focused on a couple of different groups. One is those people who are traditionally disengaged, and then also hearing particularly the voices of the Black community, because there was substantial feeling on the call that we've paid a lot of attention to the particular needs of the Latinx community, but that our African American community also has particular needs. The fact that their mortality rate is higher. The mortality rate among African Americans who get COVID is higher than among any other group. That African Americans have been hit very hard by the economic dislocation and other particular issues for the African American community. And we had a good discussion about how to try to especially hear the voices of the African American community in a different way, as well as generally our communities that have been traditionally disenfranchised and disengaged. And while there might be overlap there, those aren't exactly the same communities, and we wanted to pay attention to that. There was also a good discussion, and Pilar really made this point, and it was very important that we don't want the Black and Brown communities pitted against each other for resources. And so we had a good discussion of that and how we might think about that, and again thought that it would be very important to figure out ways to engage our African American community. The Latinx community has had a couple of really very large and successful online community meetings at which more than 1,000 people have participated. We want to create the same kind of opportunities for our African American community, and we'll be thinking about that and trying to figure that out. So there was a discussion of should we have expand membership of the roundtable, I'm sorry, of the task force, which Wendy and I are going to be talking about, as well as with our chairs. The creation of a roundtable for our traditionally disenfranchised communities, and also this talk about how we're going to do some more virtual community meetings to really inform people. So it was a really great discussion, and gratitude to Lois and gratitude to Amber for pulling that together. We've had a big discussion, I know the County Commission has as well, about the Durham Public Schools Foundation and other partners, DPS, the YMCA, and Student U have proposed Hope Learning Centers for our students who aren't able to easily access what they need to succeed in school. The Durham Public Schools has agreed to open 6 schools for these learning centers, and in each school there would be up to 150 students. So they would be able to house 900 students safely for people to come and get instruction in person, or assistance with instruction in person rather. And then the community partners are wanting to do the same. They've come to the county and the city for funding for this. They're also going to be seeking some private funding. We had a good discussion of this at the city council, and are waiting really to hear more from Durham Public Schools and the county. I will say that the city, we have our first allocation of CARES Act funding, $2.9 million that we talked a little about last week, but now we know what we'll be spending that for, at least what's being recommended, and we have to submit that to the county in a few days. About half of that funding is going to create a broadband connection at all 9 of the Durham Housing Authority communities where students live. This would be for about 1,300 students. It would also be through families. Duke and the city, excuse me, have been working on this, and DHA for quite a while, but this has now become accelerated because of the need. We hope that McDougall Terrace will be up very soon. It's by far the largest, and that work is ongoing. The other communities will take some months, and so it's not going to help us right here at the beginning with providing the internet access to our students. But we believe that it's one of these permanent investments. You've heard Wendy talk a lot about trying to create some permanent community investments out of this situation rather than just some temporary ones. And this will be a permanent community investment that will serve both the children and their families at the Housing Authority sites for many, many years. So it's a great investment. And I want to thank Wanda Page, our Deputy City Manager, and the folks at Duke for doing a great job on this. we're putting about $1.4 million in the city's CARES Act funding into this. Finally, I just want to mention outdoor dining. There's a lot of work been going on, and I know that Nicole could say a lot more about this and may want to at some point at the end of the meeting when the reports come or the roundtables. But Downtown Durham Inc. has been working with the restaurants and the other businesses and with the city. And as you know, there'd already been a way for restaurants to get permitted to be outside, but now we're talking about, or they are talking about closing streets, beginning with certain parts of Main Street where the dining could actually be on street. There are issues to work out, especially around transit. We really want our bus system to be able to efficiently serve the people that ride it. We still have at least 12,000 people a day who are riding, and so we want that to be really to continue to work well. So that's my report. A lot of great forward momentum. Much appreciation to all of you all, and I'll turn it over to Wendy.
Thank you, Steve, and good morning, everybody. I think for me, one of the big highlights is just how great Durham is doing in terms of our trends with COVID. And again, I don't want to steal too much of Rod's thunder, but I'm just really excited about what our positivity rate is right now. And again, I'll let Rod actually share that number, and also, just what our 7-day trends are looking like. I mean, it's just really great. And I just, again, I'm very hopeful and keeping my fingers crossed that even with all the students that we have back in town, that we will be able to keep this trend going. I'm sure folks have seen some news about student behavior or have experienced some themselves, but I'm really grateful that at least I've mostly just heard about Duke University students, but the great news is that Duke really is being a good partner and following up with enforcement on their end. And of course, the miraculous testing, over 5,000 Duke students that were tested, and there were only 11 positive cases at that point. I haven't heard much about NCCU, how things are going there. Maybe Anthony can fill us in a little bit later on that. And I have read a little bit about School of Science and Math, about some of the things happening there. But I know Katie and Maticia are going to talk about the education roundtable that we are getting underway. And I just think it's really critical that the approach that we're using in Durham, which is everybody working together, collaborating, communicating, is the way to go. Continue our partnership, and of course, bringing everybody into the Let's Get Back on the Bull campaign. In terms of the what's going on with county needs and funding, I think, again, it's really, my concerns are still with food, housing, energy assistance, now that a lot of these safeguards have really been removed. The moratorium on evictions is no longer in place. The same thing is happening with utility companies. And there are questions about the feeding programs for our Durham Public School student families. We still don't have the USDA waiver that we had during the spring and over the summer to really help us with food insecurity needs. I'm not sure if I mentioned before that the county, we've allocated additional funding for food. We're going to be taking up another proposal. I found out at our social services meeting this week, we did get some extra federal funding for seniors, but we have a waiting list of over 400 seniors for Meals on Wheels right now. And the additional federal funding we're getting is going to take care of about 100. but we still have a really big waiting list. We are doing a great partnership with the city and DSS with some CDBG money for rental assistance that will provide people up to $6,000, which is great. But again, you know, that money will only last a certain amount of time. So we need the assistance of our federal government and our state and government for extended unemployment benefits. And we do have some money coming in for low income energy assistance funding, again, from the state, some from Duke Energy that will help people. But the reality of people being unemployed and struggling to take care of these basic needs is very real. We are going to be looking at, we have $3.3 million worth of CARES Act funding, and Jody is our expert on this, and she's here with us too. If anyone has more questions about that, we will hear from our staff on September 8th about their recommendations for that funding. Another really big need that has emerged is the need to support our students through the virtual learning. Steve referred to these as the Hope Learning Centers. And I really want to emphasize that this is not a place for instruction. The instruction is still going to be virtual. But the reality is that we have families where there is going to be no parent at home because, you know, there's a single parent household and the parent has to leave the house for work, or both parents have to leave the house for work, and they may not be able to afford to pay to send their children to the Y or somewhere else. There's a real concern. Again, I'm chair of our DSS board. It came up just this week, children who are in foster care, who are in, whose families are involved with protective services, that it is going to be very difficult. They may not have ideal circumstances at home for virtual learning. And so this is a very real need. I know any of you who have parents at home. I was in a meeting with Geoff yesterday, and he was juggling having his kids in school and working. So those of you who have children at home, you know it is so hard. But of course, it's even harder for many of our other families. So this is a way to really address that need, that we have vulnerable children and families that need support. And that's what these Hope Centers are about, creating a place to support the virtual learning. So that's also going to be a big lift for all of us, whether it's, and I've asked, and other commissioners, we've asked our staff to look at how can we use the resources that we have in the county, our libraries, some of our staff that are, working remotely now, who would be willing to come in. We know we have community volunteers who want to help. And I can really think of nothing more important, really, when we think about how we support resilience, how we can impact trauma, and really invest in our children and their education, and the achievement gap that was very real before the pandemic and is only being exacerbated. So I hope that we'll be able to figure out a pilot or something with the county in terms of the resources we have. I know the city is looking at their Parks and Rec staff and their Parks and Rec facilities. So that's, I think that's our next really, really big challenge. And I will stop here, and I know we're going to have a great discussion this morning. And welcome Derek, our great Board of Elections director, who's with us today, does fantastic work. And I look forward to hearing what he has to say and share with us today. Thank you.
And let me add a welcome to Phil Lehman as well, the board chair of the Board of Elections.
And I'm sorry, Phil, I didn't see you. I have an iPad and I only look at who's right in front of me. But Phil also is our great board chair. Thank you.
Great, thank you so much. Great updates and a lot of really important work going on, well underway. Couple of quick updates from around vulnerable populations. So our team met this week, and the testing continues to go well at Holton. Testing is down a little bit at Lincoln, but Lincoln is putting up some, and Phil can speak to this, I think, banners on Fayetteville Street to help with encouraging that. Phil, do you want to mention anything about your testing at Lincoln?
Yes, at Lincoln, we have tested over 2,000 of our patients. We are testing about 200, averaging about 230 tests per week. We require that you call and make an appointment with us first before, so that we can determine whether or not testing is a priority for the individuals. And we have ended up on a daily basis with several vacant slots that were not filled. We know the demand is out there, so we thought it best to try to reach out to the community by putting signs up on Fayetteville Street. So we've ordered those signs, and they should be in place quite soon, maybe in a week or so.
Great, thank you.
I should say that the trends at Lincoln with the population that we're testing are similar to the overall trends in Durham County. Just that our positivity rates, of course, are a little higher because we are testing only vulnerable populations, and usually symptomatic individuals from vulnerable populations. But overall, that for the time that we've been testing, we average about a 35% positivity rate. You remember we started out with ridiculously high numbers like 90% and 85%, but it has decreased gradually. And last week, our rate was 18%. So you can see the gradual improvement.
That's great. I think the other thing we talked about was getting ready for flu season and how we come together as a community around flu vaccination and whether we can do some drive-through flu vaccination centers, if you will. And so more to come on that. The group needs to work on that. And I know there's already a lot of work underway across the community, but wanting to really get our arms around that and make sure that we are really promoting from Dr. Akinboyo, Dr. Wolf last week, Rod, they shared with us how important that flu vaccination is going to be moving into the fall. So we really want to promote that and advance that. And I think, and then I don't know, Pilar, if you want to mention the community health workers that El Centro is able to get, because that's wonderful news.
Yeah, thank you. Good morning, everybody. Yes, so we are one of the partners with Cura Americas. They got the big grant to bring on board 150 community health workers for the state. So we will be bringing 40, and some of them will be assigned to Durham. And we are already in communications with Duke and Rod to see how we can put everything together. So it's an extension of what we've been doing together, but bringing more workforce to it. So we are very excited about it, and mainly we will be doing the same things, working in the community with businesses, doing some education, food and masks distribution, and some contact tracing and supporting testing sites. So we are very excited about it.
Excellent, thank you. And then on the education roundtable, quick update on that. We have Mayor Schul has sent out to our higher education partners, and so Duke, NC Central, Durham Tech, Science and Math, and I believe UNC. Have we talked to UNC as well? Maybe not UNC, but those, okay. So the request is out. We've heard back from a few. We're still waiting to hear back from a few more, and that roundtable we put together and scheduled to start the week of the 31st. Before I turn it over to Rod, I will give the update from the hospitalizations. And continued good news, we're moving in the right direction. So our 7-day average hospitalizations is 33. It was 38 last week, you'll recall. And we have 15 in the ICU yesterday between Duke University Hospital, Duke Regional Hospital, 16 last week. We are still at 90% occupancy. Again, I expect we will stay high in terms of our capacity. Less than 3% of our patients are COVID positive. And we did celebrate in the last week our 1,000th discharge for the health system of COVID patients. So that was a milestone that we've really wanted to recognize our team for the extraordinary care they have provided. And with that, I will turn it over to Rod.
Good morning, everyone. I continue to echo Katie's fantastic news in terms of the numbers and the data. And as Chair Jacobs has said, we most certainly are trending in the right direction. We thank you all for your support of public health in this pandemic. So yesterday we had 45 cases. Our active cases are very low. We are at 292 active cases. Total discharge of Durhamites from COVID care is 6,137 cases that have been discharged. We did pick up 2 additional deaths, but ladies and gentlemen, that's to be expected because we had such a long peak in which we had significant cases. So it's expected that we would see some deaths. So our total since the pandemic began is 6,512 total cases. Between Durham County and our partners with CCNC, CCTO, we've made 12,643 contacts. As you may recall, every week, I've mentioned every week, we do have a call with the state, and we hear from the state epidemiologist, Dr. Zach Moore, and he did indicate that we are now as a state seeing sustained decline in new COVID positive cases per day since the state's peak around July the 7th. There are decreases across the board. COVID-like syndrome surveillance is down, percentage of positive tests are down, and there are also significant decreases in hospitalizations as well. So we continue to be encouraged by that good news, and the same can be said for Durham County. As of Monday, August 17th, we're at 6,464 cases. Our 7-day moving average is 37 cases. This is a decrease from an average of 41 last week and 51 the previous week. As you can recall, the 7-day moving average at one point in time was as high as 79.8. So we've definitely come a long way, but we still have quite a way to go. So far in the month of August, there have been 682 total cases. So in a nutshell, we are seeing the trajectory of lab confirmed cases starting to decline, both for the state of North Carolina, but particularly for the county of Durham. As far as our race and ethnicity trends, we continue to tip our hat to Pilar and our many community advocates, to include Katie and Phil and Dr. Howard Isaacson, and I mean, so many others. I need not name, I'm going to forget somebody, but so many different people. But our Hispanic and Latinx individuals, they continue to be overrepresented. However, we are at 38.78% of all our cases in the month of August so far being amongst this population. We continue to work hard to advocate for them as far as testing and resources. And we're so delighted that the community health worker partnership went to Cure Americas and particularly went to El Centro, because we are able to really expand our bandwidth and help out that population. Black African American population continues to be proportionally represented, because we know that's 37% of all Durham County residents, but they are right now at 37.43% of all our cases. So proportionally, they're kind of equal to their representation. And we are keeping a close eye on that population as well. Our white population continues to be very underrepresented at 14.10% of all of our cases. As far as work, there has been a slight change. We continue to see unemployed and construction individuals in those trades being represented, but we're now starting to see some restaurant workers who are of the Black or African American community, right at 54.54% of our cases for the month of August are involving restaurants. And this is no change and nothing new to us, because we have seen COVID cases in restaurant workers throughout the pandemic, but we've seen sort of an uptake. So we're continuing to work with our environmental health division and making sure that we get word out to keep everybody safe there. Proud to report that our percent of positive labs that are reported electronically continues to be down. For the week of August 9th to August 15th, 4.9% of our labs that were reported electronically were positive. This is down from the previous week where the percentage was 5.9%. So once again, we're trending in the right direction. And that also follows the state. North Carolina's trajectory of positive tests as a percentage of total tests is declining slightly, but still above 5%, whereas Durham's trajectory overall is declining. So we're certainly happy about that, and we're going to continue to keep our foot on the accelerator. We continue to have cases represented at that 27704 area code, and we continue to keep our eye on that and trying to make efforts to provide testing and assistance in that particular area as well. As requested early on, we definitely keep our eyes on the COVID-19 cases in daycares and school-age children. As we have seen nationally, we've seen an uptick. So 21% so far, or 144 cases, were of individuals who are under the age of 18. This information has been shared with Dr. Mbenga and his team with Durham Public Schools, and we're doing everything we can to make sure that they're aware and are able to provide assistance. Our active cases overall have declined, and as far as Duke's model, their growth for North Carolina was at 0.8%, whereas Durham's growth rate was at 0.5%. And overall infections, the overall infection rate for North Carolina as of last week was 6%, whereas Durham's infections have grown at just 4%. So good news all across the board. We are not deceived, because we know that fall is coming. And as we've talked about with Phil and the rest of our team, now is the time for us to really campaign heavily to get awareness out about the benefits of flu vaccines for children and adults. We're continuing to petition the state to come up with an active campaign to assist us. It is my understanding, ladies and gentlemen, they've received $5 million from the CDC for these purposes, but we're going to try to get the ball rolling as fast as we can here in Durham County. We certainly don't want that confluence of flu and COVID-like symptoms to converge at the same time. Unfortunately, we probably don't have any way to stop it, but awareness is key. At this time, I will turn it over to Dr. Akinboyo. I know she's busy, and we certainly love some comments from her.
All right, hi everyone, thank you. I continue to just reiterate what you've shared. I think it's been very encouraging that our hard work continues to pay off. and the state's goal has been to get the state below 5%. It is impressive to see that Durham has reached that. I know our goal has been to reduce, and we should continue to ensure we're reducing our local prevalence, but I think as we're pushing for additional resources, it's important to emphasize that our hard work is slowly paying off. The comment on the proportion of infections among kids, it seems it's rising. So the last couple of months, we had about 16% of positives being among children, and now we're at 21%. Does raise some concern, particularly as schools reopen. You will note, though, that most children are not in in-person school. And so locally, we're still seeing community spread that is pushing infections among kids. So all of what we've discussed over the last couple of months continue to apply as we move into school months, fall months, and the flu season. Happy to address any questions.
Very encouraging report. And Rod, I think the past couple of weeks, you've started your presentation by saying you're cautiously optimistic. So do you remain cautiously optimistic?
I really do. We just know that fall brings a whole lot of uncertainty, and we certainly want people to get their vaccinations, particularly flu. It is my understanding toward September 1st, it should be available, should be ready, but we'll be sure to publicize that as fast as we can. But again, we have seen the UNCs and the North Carolina states. I do know that don't want to steal our central representative's thunder or whatever, but we know that Central is concerned, and they're in the process of coming back, and they have voiced a lot of concern. But I will say that they have a good plan. But again, human behavior and those proper activities are the things that are garnering success or failure. And as Chair Jacobs has said, with Duke, with their mass testing, with their compact, and with their overall community concern for one another, that's the reason why they have garnered a lot of success thus far. We're certainly hoping for the best with our kids and staff at Central, but we're going to continue to work closely with them because, as I said before, I believe in Durham. I believe that we're going to do the right thing, and I believe that we're going to be successful.
Thank you for that.
Maticia, I have a quick question for Rod and Dr. Akinboyo. And this is related to some of the comments that Steve was making about the good conversation about us not making sure we pay attention to what's happening in the Black community as well. I had noticed that, and you've noted it too every week, Rod, that the numbers are going up within the Black community. And I was concerned to see that we're now at 37.4%. And then also noting that we're seeing the disproportionate with the restaurant workers. And so I'm just wondering what any thoughts you had of what we should be doing right now, because I'm so grateful that we are tracking this data this way and we are disaggregating it by employment so that we can pivot. And I don't know, Ryan, I don't know how often the restaurant roundtable is meeting right now, but just wanted to hear your thoughts on, should we be, raising an alarm or putting out some flags, or should we be readjusting some of our efforts if we're seeing these type of trends?
That's a good question, Chair Jacobs, and thank you for asking that and raising it. I would not say there's a need for alarm, and I take you back to the late April timeframe of 2020. And that's when my staff and I really saw the numbers for the Latinx population just really skyrocket. And it was certainly a cause for alarm because it it rise so quickly that, you know, we were able to really notate it and catch it and be able to get some more awareness about it. And, you know, as Mayor Schul said, we certainly applaud Pilar for saying that we don't want to pit brown versus black and, you know, fighting and competing for resources or whatever. But of course, as I've said so many times to the Durham community and to the members of the Recovery and Renewal Task Force, we tend to pivot and move as the data presents itself. And during that particular period of time, when you say close to 60% of all of our cases, some may say 70% of our cases were coming from the Latinx community, that was a call to action. As you mentioned now, we're starting to see an uptick in the African-American community. So we certainly will pivot and avail ourselves. But we have always made the information available. We've always made sure that we stayed in communication with those advocates to ensure that they are able to spread the word. And I think we've done a fairly admirable job of that. So we will continue to do all those things and exhibit those behaviors to bring awareness. And I thought it not robbery to avail myself to any community that could spread word about that COVID message, about, you know, just keeping safe, washing your hands, social distancing, and then seeking care. We are seeing testing numbers decrease, but again, within the African-American community, there have been a number of testing events specifically for historically marginalized populations. I don't know whether or not it's COVID fatigue. I don't know whether or not it's just, you know, a number of different factors, but as Phil has said, testing is available. It's there. Slots are available, and there have been times when slots have been open at Houghton. There have been times when slots have been available at Lincoln. But we implore you all, you know, please get tested. You know, it's there, it's available. But we'll continue to do what we can. And I'll definitely offer an opportunity for Dr. Akinboyo to weigh in.
Slight struggle with my unmute there. But thank you, Rod. Thanks for the question as well, Commissioner Jacobs. I think we've seen a shift towards proportional spread. So all that means is when we look at our population, if you have 100 people that are infected, if it's being spread across each community in the same way, you would see the same breakup in the population reflected in COVID data. That's sort of a long-winded way of saying, right now, as we're seeing an overall reduction in cases, we're also seeing it shift towards the number based on race in Durham. We're seeing the number sort of shift towards our typical racial breakup. But that does not mean that we don't need targeted information and targeted resources for communities that have already been disproportionately affected by this. And that would include both the Black and the Latino community at this time. So I think, yes, the future or our next efforts do need to focus on testing and education within communities that may congregate in other settings other than just sort of our media efforts that I'm sure a lot of work has gone into. I know some people are reaching out through churches and through other just community groups to ensure that the information there and access to testing is shared within that group and those settings where people meet. But I wouldn't necessarily be as alarmed as we were 2 months ago. It's just sort of a shift towards matching our population.
Mayor Schul.
Thank you, Maticia. And I've been doing a little math and listening as I've been listening to Rod and Ibukun to just think about this a little bit. When our African-American cases were about 15% of our total, and we had 80 cases a day when we were at our height, that was about 12 cases per day in the African-American community. Now we have about, I believe Rod said about our 7-day rolling average is 37. I believe that our proportion of African-American cases is also about 37%. So that would be about 13 cases per day this last 7 days. So just to it's not that we're seeing a lot more cases in the African-American community as Rod and Ibukun have been saying. It's just, I think, one of the things to think about is to just attribute this to the great work of public health, to the great work of El Centro and so many others, Latin 19. And it really is reflecting the reduction in cases, in our Latinx cases, that shows this proportionality. And so it really, I think it really highlights this great work. But I did think that it is important to think about, now that we're going back to this more proportional representation that Ibukun talked about, to continue to think about those communities that are, have always been disenfranchised, and continue to do the work there.
Thank you for that. Any other questions for Rod or Ibukun before we move on to our next topic? All right, great. So the bulk of our agenda today is for us to spend some time discussing how we go through voting, voter registration, how do we handle a census during this global pandemic. So I want to welcome 3 individuals that's going to lead us through that conversation. So again, welcome to Derek, who is our Director of Elections, Phil, who is the board chair of the Board of Elections, and also Kate Feldman, who is the Executive Director of You Can Vote. So I'll turn it over to the 3 of you to take us through our next topic. Phil, I think you're on mute.
Okay, I'll start it off. Thank you. I'm Phil Lehman, the chair of the Durham County Board of Elections, and I'm here with Derek Bowens, who is our elections director, the one who does all the work to get us ready for this election. Thanks for having us here. I mean, we definitely want to get the word out that in spite of all the challenges we're facing, that we have done extensive planning and preparation to make sure that the voting experience is safe, that voting will be accessible, that it'll be secure and relatively efficient under all the circumstances. This is an unusual year. Most of the election year, all the discussion is about the candidates, who to vote for. But this year, a lot of the discussion is about the mechanics of voting, and people are really worried about it. We get lots of questions about, is voting in person going to be safe? Are we going to experience chaotic situations like we saw this spring in Wisconsin and Atlanta? Are we going to have enough staffing to cover all the precincts on election day and all the sites for early voting? Are we going to wait for weeks to get the absentee ballots counted and have some idea of who has won the elections? But we need to confront all these questions, and I think we can cover most of them today. I first want to, again, thank Derek and the staff. There's a full-time staff of 11 people for the Board of Elections, but as we get closer to the election, we obviously have to staff up, and there will be a lot more temporary people, both to do the very, very labor-intensive job of processing absentee by mail ballots and requests, and of course staffing the voting sites themselves. But let me turn over to Derek to explain some of the, I think, very extensive measures we're taking to make sure that voting in person is going to be as COVID safe as possible. Go ahead, Derek.
Thanks, Mr. Chair, and thanks, Task Force, for the opportunity to speak today about what we're doing at the Board of Elections to prepare for in-person voting. So I'll start with just a COVID-19 preparations update, things that we're doing to ensure there's a stay healthy and vote, or a healthy environment as part of our Stay Healthy and Vote campaign. Just for reference, we do have a COVID-19 mitigation plan page on our website, which you should be able to see at the bottom of this particular slide. So feel free to utilize that to get the more comprehensive picture of what we're working on. But as a snapshot, we will have personal protective equipment for all of our election workers. That includes table shields, face shields, cloth masks, gloves, gowns, and additional materials. Many of these things are being produced locally. Face masks for each voter. That will be optional. We cannot enforce voters to wear masks when they come in person to vote, as that could be seen as a barrier to exercising the franchise. Hand sanitizer will be available at entry and exit. We also will have adequate cleaning supplies at sites, alcohol-based sanitizer, again, produced locally. Cleaning wipes and other supplies provided directly from the State Board of Elections through a mass distribution with some individuals they're working with state emergency management. Site cleanings pre and post election will be conducting electrostatic disinfectant sprays of our election day polling place sites and early voting locations before voting begins and after. During early voting, we are going to have daily cleanings from a professional company at the close of voting each day or in the morning prior to voting beginning. We also have cleanliness coordinators that will wipe down high contact surface areas throughout the day. Social distancing with identifying markers. Thanks to Durham County, our General Services Department, they've created lots and lots of social distancing markers for us. So we'll be using those throughout our enclosures. So there's a lot of things going on here. We're also working on some contingency planning in case we have to conduct deep cleaning if there's a COVID scare, as we discussed with our public health director yesterday, to respond to that in the event we do have an issue as a result of contact tracing or some other notification in that regard. And I think, Mr. Chair, you wanted to give a overview before we went into the next portion.
Yeah, okay, sure. I wanted just to quickly cover the three methods of voting. Probably the most common question that I get from people is, how should I vote? Very legitimate question in these times. And first, we have three different methods of voting. They are all fine to do. My personal recommendation, this is not the official position of the board, but is to vote early. Why? Because we have, I think, probably the most robust early voting plan in the state. We have 14 sites around the county. They are going to be open for 17 days prior to the election. Every day, except for the last Saturday, the sites will be open until 7:30 p.m. The total of hours, the combined hours, is for all the sites and the opening hours is 2,500 hours. This is a 60% increase in available hours from the 2016 election. So the early voting will be accessible. There should not be any crowds. And I think it's a very, very good way to vote. We have a concept of overflow sites. So among the 14 sites, for example, the downtown public library is a site, but we also have a site at the Criminal Justice Resource Center, and people will be able to go online at the Board of Elections website to determine whether there are lines or delays in any of the sites, and if so, they can go a very short distance to another site. In 2016, approximately 70% of Durham County voters voted early. And that really helped take the pressure off election day voting and mitigated the possibility of crowds and lines on election day. And we hope to do at least as well this year, and I expect we will with all the mail-in voting. Voting by mail, the second way of voting. Again, a good way to go, in my opinion. It's been a little bit overhyped, but it's obviously safe, and if you have any concerns about personal contact, it is a great way to go. The problem is it takes time. There are a number of steps. You've got to follow the instructions to a T. and you've got to make sure you're doing this well in advance because of all the problems we're hearing about the post office. Do not wait until the deadlines to either request an absentee ballot or to mail it in. Do everything well before the deadlines. I think, in my opinion, well before, at least by mid-October. As I said before, it's also very labor intensive. We have a full-time staff of temps right now. We're 9 people working on processing absentee ballot requests. That number we're moving up to about 15, just doing nothing but handling requests. And later, beginning September 4th, we'll be able to send out the absentee ballots themselves. But we had one day, about 10 days ago, we received 4,000 absentee requests in one day. So as you can see, that's a lot of work, but we're keeping up with it, and I think we're confident about our ability to handle it. A lot of people are telling me they are requesting absentee ballots as an insurance policy. They intend to vote early, but they can, they want to have both options available, and that's okay. I tell people you don't have to turn in your absentee ballot if you prefer to vote early. The final method is voting on election day. Again, this is fine. I always used to prefer to voting on election day, but I voted a fairly small precinct where there are rarely crowds. We have precincts, particularly in southern Durham, that have grown enormously, and they could get really, really busy on election day if people don't vote early. But we have 58 precincts. They're all staffed, COVID preparations for all of them, and that should be fine also. I also hear a lot of misconceptions about voting and questions. One is, why don't we send out absentee ballots to everybody? Well, we can't do it by state law. You have to file a written request on a mandated form to do it. And we've got to wait to get that, and we've got to mail out the absentee ballots. Why don't we have drop boxes all around town for people to drop off their absentee ballots instead of relying on the postal system to get them in? We do allow people to turn in their absentee ballots at early voting sites, but under current law and state regulations, we cannot have drop boxes that are not fully staffed. So if you want to turn in your absentee ballot in directly at an early voting site, you can do it, but you have to check in with a voting official. It is not a contact-free experience, unfortunately. We've been dealing with the state board trying to get that loosened up, but at this pretty late date, no movement yet. Mailing in absentee ballots, of course, the deadline to mail is November 3rd, election day, but they also have to be received by November 6th. You can mail in your absentee ballot on, say, October 31st, but if it doesn't get to us by say November 7th, that ballot will not count. So factor in not only the postmark, but sufficient time for it to get to the Board of Elections. Curbside voting. I've seen some information out there telling people if you have any concerns about voting in person, just vote curbside. We do have a curbside option available, but it is for people who have disabilities or other limitations that prevent them from voting in person. It is not a drive-through voting experience. It requires more touches. It takes more time. So please don't use it unless you have to. If you do, that's fine. But it's not, a drive-in, drive-out experience at all. Final question I get a lot is about counting absentee ballots. People think we're going to wait till election day to begin counting, and we won't know for at least a week after what the absentee results are. That is not true. Beginning September 29th, the board is going to be meeting regularly, probably twice weekly, for the purpose of counting absentee ballots. We don't actually count them. We approve the absentee ballots, and then they're tabulated. We don't release the results, but all absentee ballots that have been received by November 2nd will be tabulated on election day, and the results will be released at 7:30 p.m. on election day. absentee ballots that trickle in after election day will obviously be counted later, but we should know the vast bulk of absentee ballots on the totals on election day. All right, that's it. I'll turn it back to Derek to talk about finances and staffing and public communication.
Thanks, Mr. Chair. So I'll briefly touch up on a couple things. I have some slides in between here, but Mr. Chair covered that all very well. Just a sample diagram of social distancing we're working on at all of our facilities. Early voting, our chairman gave a great detail on that. There's some links in this particular slide with resources that we have available. One that we really want to push is our early voting locator tool, which now, in addition to wait times and finding the location closest to you, it also has a bus route option where you can find routes to locations from your location. Absentee by mail, as the board chair said, we have a substantial amount of those coming in. We've established a dedicated absentee response and call center and a call flow that will direct individuals calling about absentee by mail directly to our call center. As of 8/19, we've received 17,856 valid absentee requests. That puts us at almost a 250%, over 250% increase from the 2016 general election at the same time. We also have several in our queue. The real number is over 20,000 at this point. Ballots, of course, will start going out on 9/4 as the chair stated. One thing I do want to mention that we're doing to try to increase expediency in terms of getting these ballots out is we've been working with our local bulk mail through the Postal Service with a business imprint account. That way we can just drop ballots off at bulk mail in lieu of stamping each of them individually, which has been past practice. Election day, again, the chair spoke to election day. Briefly, we are doing a whole scale analysis of voting enclosures across the county, moving a lot of locations within existing enclosures to larger spaces to allow for social distancing. In the event where we cannot find larger enclosures, we may have to move some facilities. The board will address that in September. Extensive recruiting. We've got hundreds and hundreds of people that have indicated interest in working the polls. Durham County has approved an employee participation program where we'll be able to pull on county employees to work the polling places. And also 90% of our training activities will occur now online through our learning management software, Talent LMS. Outreach initiatives. Of course, we just finished the I Voted sticker contest. This is extremely popular in Durham County. We've got over 1,000 people indicated interest in serving as poll workers as a result of this contest. Got a lot of free media coverage about voting as a result of it, so we're proud of that. That is the new sticker if you haven't seen it. We're working on messaging in the City of Durham water bills, radio advertisements, of course, Durham County Television Network. Got a lot of participation in community events and forums. We hope to do a Zoom elections open house, which we started last year to allow the opportunity for the public to ask questions and to give general election information. And of course, public service announcements. We hope to be able to do a mailing to each household, but that is something that is under consideration and underway. Also, if you're interested in receiving direct important election messages via text from the Board of Elections on our website, you can subscribe to our messaging system to receive that information. So that's also available. Just real quick, financial impacts. Obviously, COVID-19 is expensive. As I know the task force is aware, it also applies to elections administration. Of course, we submitted a budget before for the upcoming fiscal year before we were really informed about the realities of COVID-19 and its effects. So we are working with the county in terms of the funding piece. We've also are waiting for receipt of $277,000 in CARES Act funding from the State Board of Elections via House Bill 1169 to offset some of the COVID-19 related expenses that we're dealing with in executing the election. There's also an additional funding source through a reimbursement program in that bill. And I guess if appropriate, time to take some questions.
We have to hear from Kate too, I believe.
Oh, yes. Sorry, Kate.
Yeah, I mean, how would I go and then we can have time for questions? How much time do we have left? Just want to make sure I'm not going over.
Well, let me take a quick look at the agenda. I think we're good until about
Until 9:30.
Okay.
We're good. Okay, so I just want to thank the Durham County Board of Elections. You're wonderful, wonderful. We work with lots of county boards of elections, and you're always just so on top of it and just so easy to work with for the voters, and just very thoughtful and well planned out. And I just have to give Durham a huge shout out for this. So our number one focus right now is voter education. There's so much misinformation, so much panic and anxiety about making your vote count. And then of course, there's this challenge of, normally people are out and about doing all the voter registration. You being in Durham, you probably would have been asked about 100 times by now if you were registered to vote, or if you've moved since you last voted by one of our volunteers or some other volunteer. And that's just not the case right now. And so we're doing everything we can to get our voter guide and our voting materials and voting information, fact-based voting information into the hands of voters. And I'll walk you through our voter guide, and then I'll walk you through our Champions program so you can spread the word and have folks sign up, because I've been calling this an each one teach one election. We really need people who have access to voters and who are, talking to community members to be the one teaching and sharing this information. And we made it all free and at your fingertips. So on our voter guide that we point people to on our materials, it's simple. We've got the where do I vote early, where do I vote election day, and how do I vote by mail? So our vote by mail guide is very, as easy as it can be to get through the technical process steps of vote by mail, so that folks understand exactly what steps they need to take to make sure that that ballot counts. What I like to say is, like, early voting, 99% of those votes count. And Phil, you can tell me if I'm wrong, but absentee voting, about 15% of those ballots get rejected for simple technical errors by the voters. So really have to pay attention to do it absolutely correctly if you want your vote to make sure it counts and not be late. So here are our instructions step by step. That's a great resource to share with folks. Like I said, I tried to make it as simple as possible, but it's a lot. And when the online portal for absentee ballot requests comes and is available, we will link that here too. But right now it's still the paper form that you can download and turn in to the Board of Elections. But yeah, early voting is a great option. And I'm so excited to hear that 60% increased hours. This is our fridge card that you may or may not have been offered by one of our volunteers in the past. And we make sure we go over, like, you don't need a photo ID this year. The only voters who need some sort of ID are those who are registering during same-day registration and early voting. What's on the ballot? We've got that guide right here. I'll scroll down and show you that too, for candidates, and then to research your candidates for the offices that are on your ballot. And then here's the early voting schedule, and vote at any early voting site in your county. And this links all back to this page so folks can look up their early voting site. November 3rd, but only at your polling site. And then until September 30th, we have the census on all these cards. And these are in English and in Spanish. And in the Spanish version, we have the direct Spanish link and the direct Spanish number. So we want to get one of these fridge cards in everybody's hand. And we have the voting hotline on there in case folks need a call, phone a friend, our friends at Democracy NC man that hotline. So on the back side, I didn't know QR codes were still a thing, but they are especially important during COVID for touch-free voter education. So this goes back to our voter registration site. And the messaging is, are you new? Are you a new voter? Have you moved since you last voted? or have you been removed from the rolls? A lot of folks are going to participate this year that maybe haven't voted in 8 or 12 years, and they may have been, cleaned off the rolls. So it's time to confirm your registration at youcanvote.org/register. You'll look yourself up. That's the first step. And if it says you're not registered or it has an old address, it'll take you right into the option of voting or registering entirely online for DMV customers, or getting mailed a form that we pay for with a pre-addressed, pre-stamped envelope to the County Board of Elections. And so here's the 3 ways to vote and the eligibility for voting. So we want to get one of these cards into the hands of every voter, and we have a ton of great partners in Durham to help get these out, but we want to make sure that everybody knows that these are available to you. Here's the registration tool. I think I started on this page. This is where you look yourself up and see if you're registered at the correct address. If not, you'll be given the choice if you have photo ID from the DMV. If you're a DMV customer, you can do it entirely online. They have your signature. This is a great improvement. If not, like I said, start it online. We'll mail you the form with a pre-addressed stamped envelope to the Durham County Board of Elections, all free to you. You just need to sign it because you need your signature. And students, we have the dorm address cheat sheets right here. If you're a student, in a dorm, there's a specific way that you need to register to vote. And we have all of those for every county here. And then of course, we've got paper forms, all of the rules, all of the deadlines on this site too. And then I want to make sure that everybody knows vote411.org is a great nonpartisan voter guide by the League of Women Voters, where you can do candidate side-by-sides and read up on your candidates. But I really want to make sure everybody knows that we have this fabulous resource that we developed and created ourselves, because I think it was when we went to visit a GED program in Durham, and it was early 2018, and the students were asking, we're voting this year? What are we voting for? Is it president yet? And so we really needed to start connecting what people's actual lives are caring about and how that connects with their ballot. So this is an interactive guide. So if you care about healthcare, this is all the offices that deal with healthcare that are on your ballot. We have a little 2-minute video here, and this can be your homework to go and look at that. But then we go over all of the office and choice points on your ballot that are on there every single year. And people will run for your vote. So this will give people sort of okay, this is the responsibilities. And so then you can better be a judge of the candidates running for these offices. All nonpartisan. We don't take stances on issues, but we just present voters with the facts. So go ahead and take a look at this and share it. We want this voter education to get out, because that's just the key to civic engagement, is just teaching how these different offices intersect with what's really going on in your life. Civil rights and healthcare are animated. Education is being released this week. I'm going to have that video done. I think it's done today. And then our next step for animation is the criminal justice. So that is a great tool. And then a reminder that photo ID is not in place anymore. And so back to our site, I want to introduce the Champions program to everyone so that we can get this information out to our neighbors. Basically, if you are an organization, any kind of organization, as long as you're not a partisan campaign or a candidate, we can provide you for free with materials to educate voters and training. So, normally these have to be passed out by a trained You Can Vote volunteer, but we are in a whole different world right now. So we're offering our training library. We have a little training video, 7 minutes for our champions. We also have the full training, 1 hour, twice a week on our events page. Folks can do a longer training. A social media toolkit available. We have all sorts of good businesses already coming on board that we're celebrating. Monuts is one of our champions, for example, is just the one I have off the top of my head. But we have the signage that points people, confirm your voter registration, your voice matters. This is all language that we have found absolutely works to help voters sort of believe in themselves and believe in their right to vote. Second side is in Spanish.
the fridge card. This is what we want in everybody's hand in English and in Spanish. And then you just need to read, what's on this card is basically what voters need to know. We have the little flow chart on how to use the registration, online registration portal. And we have this in English and Spanish as well. We have our masks, and we have more masks coming with another design. I've been asked for orange masks, so they're coming. And then this poster is really, it looks so great. I have one hanging behind me, but it's hard to see. We have this in English and Spanish as well. Confirm that you're registered, make your plan. I've been hearing this, I've been watching the convention, and plan is everywhere. I'm like, yeah, we've been saying that for a long time. But the 3 voting options, links to, how to look those up and make that plan, what's on the ballot, the link to our what's on the ballot tool, and then of course the QR code takes you to our registration page. So this is available in English and Spanish, and all of this is free to everyone. And of course, we can provide you with the forms, the Board of Elections can provide you with paper forms, but we're really prioritizing those in residential facilities. And we are really promoting that touch-free registration on our voter registration landing page as sort of like the easiest option. I know you can go straight to the DMV, but if you're not a DMV customer, you can't use it. And if you don't know your full social security number, nope, you have to know both of those things in order to use that online registration. So ours, you have sort of this option, whether you have that ID or you don't have that ID, everyone can do the registration no matter what. So see, these are some of the great tools we have. And I recommend that everybody comes to one of our volunteer trainings. I have one Saturday morning. It'll be a longer explanation of this that I just walked you through at a really rapid pace. And then, tell people how to sign up to volunteer once you attend a training. We are doing phone banks and text banks and all sorts of things. And that's a way to, for folks maybe interested in the Champions program to come learn a little bit more too. So go ahead. And one more thing, we've gotten so many questions about what do students do if they move and then they move back. I like to just say, remember the rules. We have until October 9th to register voters for Election Day. If students are moving, they can update their address through October 9th or vote early. We are really encouraging students to vote early. I think people get nervous, but you just got to go back. Okay, what are the rules? How do we navigate this? We don't need to think about 50 different scenarios. We just need one plan and to know our options. And so here's a quick little video for everything students need to know. We've made custom videos like this for a lot of college campuses across the state with their specific logos and that are sent to their students in their orientation and in front of their classes. So go ahead and check that out when you have a chance. Now I'll stop talking and people can ask questions.
Lots of great information from you, Kate, Phil, and you, Derek, as well. And I love the new sticker, Derek, the I voted sticker, so absolutely love it. But any questions from the task force on any of the information that's been presented, or just any question that you may have in general?
Could one of the panelists talk about same-day registration?
Go ahead, Derek.
So yeah, registration, voters can present in person if they miss the voter registration deadline during the early voting period. Of course, as long as they meet all the registration requirements, residency requirements, they can present in person, register, and vote at the same time. If you come and do in-person registration, you will have to provide proof of residency. And that can be a bank statement, utility bill, government check, paycheck, or other government document with name and address, in addition to a photo identification that has that information. That also includes student identification cards. Us here in Durham, we actually have a database of names that we get from Duke and NCCU. So if a student comes in and they show their student ID and it doesn't have address, as long as we can confirm it in that database, the student identification card would suffice to meet those requirements. So that option certainly is available to anyone that wants to use it during the early voting period.
And again, what about returning the absentee ballots? The options?
Mr. Chair, do you want to speak to that?
No, go ahead, Derek, if you want.
So returning absentee ballots, statute allows essentially 3 options. One, you can send it by U.S. mail or commercial courier service. You can return those in person at the Board of Elections or in person at an early voting location during that period.
So if you return it in person at your office, is that a contact-free exchange, or do you have to sign in?
It is not. We currently have a state board implemented administrative code that requires voters returning absentee ballots to complete a log affirming that, you know, they're the voter's near relative or verifiable legal guardian, getting their signature. And a lot of this, the genesis of this really sprung forth because of what happened in CD9 in Bladen County. Before, of course, this was not a requirement, the logging aspect. So it is not a contact-free option. We are considering setting up canopy outside of the office to try to make it somewhat drive-through, but that does not eliminate the requirement to complete that log unless the State Board of Elections were to consider a temporary rule change or some form of an emergency order eliminating that requirement.
Thank you.
Other questions or comments? Chair Jacobs.
Well, I just want to thank, first of all, Derek and Phil and Kate for presenting to us, but really for all the work that you've been doing. So impressive. Everything that you have shared with us reflects just an incredible amount of work. And so thank you. So related to getting out the information, I know, Derek, you said information was going out in power, I guess in the water bills. Have you thought about trying to get into the tax mailings that will be going out, I think in early September, that the county tax office will be doing?
Yes, we're working with Deborah Craig Ray on that. So we do plan to also have a message with the tax bills, yes.
Okay, and I don't know, Kate, have you, I think you know Deborah too, working on the census campaign. Are you going to try to get stuff in there as well related to the census and you can vote?
Yes, we did ask about getting information, but you know, Derek, I can work with y'all to, you know, make sure that it lines up with both Board of Elections. I think there was something about not having outside, you know, agencies do advertisement in that bill, but we are working with transit. We're working with Go Triangle, Go Durham to put advertisements in the buses. And that will be a lot more focused on felon restoration of rights so that we can talk about, know your rights. That's another hashtag besides make your plan this year, know your rights. And there's just so much misconceptions around who can vote after they've come into contact with the criminal justice system that we're doing a specific campaign around that through transit. And, we do work in the jails and the detention centers across the state. So we have got posters and signage with Know Your Rights and working with reentry partners to get that word out that, hey, if you've been locked up, you still have the right to vote. And we have on our handouts page and right on our main page, we have Know Your Rights, sort of 2-pagers that are really simple to read for all of our different populations. We got one for LGBTQ voters, one for accessible voting for folks who've experienced maybe homelessness. We have one for military families, you name it. We have Know Your Rights documents for all these populations that we really want folks sharing. We've tried to make everything just public and shareable and findable on our website. If you have any questions, please refer to that. And on our training documents page, we also have, and we keep updated, this Q&A. As Derek and Phil said, there are so many questions and confusion, and we are facing misinformation and purposeful disinformation and infiltration. So read that, read the Q&A, the most common things we hear about absentee ballots or voter fraud. We keep that up to date. And we also on our main page have a reporting link for anyone who sees misinformation or disinformation or any of these things to report, content, problematic content. We need you to report it because we've got a whole team of people that are watching this. And I know that's a really big concern for folks. So right on our homepage, you scroll down, there's a report suspicious content. We want to get that out. So we're just trying to make our website as easy, and voter friendly, and as comprehensive as possible.
Thank you, Kate. And I didn't know if we were having a separate conversation about the census. But Kate is one of the leaders of our census effort in Durham too. And I don't know if folks know that we only have until the end of September to get people to fill out the census, and we're way behind in Durham, way behind. And this impacts our federal funding for so many programs. So I guess I'm thinking Ryan and Brian about how we could even use the roundtables to help share information about voting and about the census, because with everything that's going on, it's just so much harder to get information out to people. So I you don't have to answer now, but I hope that we can look at ways to partner to get this information out. And
I do have one little update, if I can. I don't mean to interrupt you,
yes,
but for census with the fridge cards and the education, there's going to be a Fuel the Vote event, a free food giveaway on the 29th of August, and in partnership with Mayor Schewel and a national organization, When We All Vote, and a food distribution organization. They expect at least 5,000 folks to show up. That media advisory is going out today. And we're going to have a DJ. It's going to be lots of fun. And as cars enter, they're going to see our yard signs, and then they're going to be approached with a tablet. You can vote volunteer with a tablet and voter education, and make sure that they've taken the census, make sure that they're registered. And so those are the kind of creative things outside that we can do in lines with people safely. That's our biggest priority, is to do it safe with our volunteers.
that's fantastic.
And if I just add one thing, we have started working with roundtables around this information. So our Places of Worship roundtable, Kate actually presented this week to share with our faith leaders about both voter registration and census work. And Kate has also presented to our Back on the Bull communications team. And we're talking about how to incorporate, some of this messaging into that campaign as well.
Fantastic. Great. And Phil, I really think your message is really important about early voting. I know with everything that's happening with the post office on the national level, and people are really, really concerned about the mail system. And I think we do need to take that seriously. And the fact that our state board at this point will not allow us to set up the drop boxes, which seems like a no-brainer. I was just on a social get together with a friend in Seattle last night, and she was talking about they have been voting by mail for years in Seattle and in Washington State, and they just have drop boxes at libraries and all over the community, and people just put them in a box and that's it, or they mail it back directly. So this is not for now, but we definitely need to be working and pushing for how we make things easier for people. It sounds like we're not going to have the drop boxes for this election. So I think, Phil, your message about early voting, the fact is that you all, Derek, what you and your staff, and what Phil, you and the board have done to make the voting sites care, as safe as going to the grocery store or any of the other necessities that people are doing now. We're all going to the doctor's office. I went to the dentist yesterday. There are safe ways to do things. We have people that are going to work every day, and it is going to be safe to vote in person. You all are doing everything to make it safe, and certainly with the huge timeline for early voting, the hours every day, all of the sites, they will not be crowded. It will be very convenient. And so I agree that we really need to get that message out to people. And plus you can, if you need to change your address or there's some issue, you have the opportunity to deal with it right there, and you have the time to deal with it. So it sounds like we really need to be pushing that because of what we have here in Durham County. So thank you.
Thank you.
It definitely sounds like there's a lot that we can do as a task force to support the efforts here. But I would like to say to Kate and Phil and Derek, do you have any specific ask of the task force to help you with your efforts?
Just do what you can to spread the word. As Chair Jacob said, that early voting is a safe experience. If you go to the Food Line or Costco, this will be safer. All the employees will be wearing either behind plastic partitions, or they will be wearing both masks and a plastic shield on their face. It is, yes, it's a safe way to go. So spread the word. Thank you.
I'll just say 99% of those votes count. That's what I want to hammer home for folks. I think everybody feels like they need to vote by mail, and that's how we're doing it this year, just because of the national conversation too that adds to it. So I've just been really hammering home 99% of early votes count, and you can update your voter registration at early voting. Anything's wrong, your vote will count. And vote by mail, you have to do it exactly right, and it has to be on time. Signature in the wrong place, it could it could lead to your vote not counting, and nobody wants to experience that, because it'll turn them off from voting, possibly forever.
All righty. Well, thank you so much for joining us this morning and providing us some education about the process, and certainly looking forward to providing the support that we can as we go through this election this year. So many thanks. All righty. So I'm going to move us on to our next topic, and I'll let Katie, I saw you came off of mute, so I'll let you take that one.
Sure, I'm happy to. I'm actually going to turn this over to some of our roundtable, those who've been participating in the roundtables, but we do want to get some updates from our roundtables. And so certainly as we move into that, I understand there is we know that we have the Trilingual Town Hall meeting coming up. And I don't know, Pilar, if you want to be able to give us an update from the Immigrant and Refugee Roundtable on that, because that's very exciting, and the flyer is out. Looks great.
Yes, thank you. Yes, we are very excited of having this town hall. I think it is very important for the community. It's the first time there is in 3 languages, so it's going to be English, Spanish, and Swahili. And the other exciting thing, I think, is we will have people from the community members in the panel as panelists, asking questions, about issues or things they have in the community. So I think it is very, we've been having meetings, preparing, and I know it's going to be great. And people can, the only thing is we weren't able to streaming because it's a new thing, very difficult. You need a lot of technology to have participants outside from the room. So, but the idea is to record it and then share it. But we will have these community members who are getting prepared to ask their questions real time. So we are very excited. Please share it widely. And when you share the flyer that is really nice and is in the 3 languages, you have to share the Zoom link because it's, of course, it's not in the flyer. So please make sure when you share it, share the Zoom link at the same time.
Great, thank you. Was there anything else from your roundtable that we should be aware of or that you need help with and support on?
Thank you. So I think we spent the majority of the time talking about the town hall, but also we talked about the proposals we are working on. And I think that's mainly what we talked yesterday in our meeting.
Excellent. Great. I don't know, on the restaurant roundtable, I know there's been a lot more conversation around expanding outdoor dining. And Nicole, I don't know if you or Brian want to share any updates on that.
Give Nicole an opportunity to come off mute. Go ahead.
Coming. Here I am. All right, I was eating a banana. Here I am.
Sorry about that.
No problem, no problem. I waited just at that moment to start eating breakfast. Outdoor dining. We have a few restaurants, more should be coming out in the next couple of days, doing the outdoor dining adjacent to their space. But we have been working with the city on what it might look like to close roads in the downtown area and allow the seating to be expanded into the streets to give people more comfort in coming and sitting down and eating. So we're working through that process with the city. We had an initial meeting last week with transportation because a major concern is the movement of buses, but also just cars in general. This would not be continuous, but a couple of days over a weekend, maybe Friday, Saturday, Sunday. We're really trying hard to get this in the next 2 weeks to do a pilot to kind of work out any kinks that we have. So we're looking at a small block on Main Street where 6 or 7 restaurants could participate, and then expanding that and then doing it again Friday night, Saturday night, from between the hours of 5 to 11 or 5 to 10. Just based on the needs of the different restaurants. So we are slowly working towards that. Hopefully we'll have a pilot that we can push out for folks to come into downtown. We're being very clear that there's some responsibilities that the restaurants would need to take on, reservations, ensuring that the spaces do not exceed their 50% capacity, that they would do a lot of the pushing out of the message that this is happening. And then we are trying to keep the plan, and the hope is that we would keep the center part of the downtown street open so that people could move throughout that area without having to mingle in with the chairs and stuff, so that there's movement. And then if you have a reservation or you have purchased food, then you could come out into those dining areas. So just kind of working on a bunch of different moving pieces. Of course, the other issue is the alcohol piece and whether the ABC license would extend. So don't have answers, lots of questions, as with this entire program has been, but appreciate all the support from the city on working through this. We have another meeting today to drill down on some of these concerns and issues, both with the planning department and transportation. And I think we're trying to get someone from Go Trilingual, Go Durham to be on that call as well. So probably we'll have more to report next week.
Great, that's terrific.
And Katie, one other thing I'd add is that we are getting feedback on this proposal from both Rod and his team and from Dr. Akinboyo. And so we'll be, we're trying to proceed, making sure we're driven with, public health and public safety at the center of this. So I know that they're working on that and appreciate them reviewing those proposals.
Excellent, that's great. I know.
Katie,
yep,
I'm sorry, go ahead. I just have a quick question related, just to clarify. Nicole, are these going to be large outdoor seating areas that any restaurant can use? So they're more communal, is that the idea?
For this pilot, it's not my idea that that would be the case, that you would have the space, the street space in front of your restaurant,
Okay.
and your dining capacity. And there would be more, you couldn't go over the 50% capacity, but there could be more space between the tables so that people who were like, yeah, I'd eat downtown and outside, but still it's a little too close, might be encouraged. So that is my plan, but today we have a conversation, but I don't believe that there is a thought that we would just put some picnic tables down the middle of the road and folks would just come. I think at some point we might get to that, and I could be speaking out of turn. You're really asking what my opinion and hope is for the program, but we might be able to get to that in phase 3 where there is more communal. I would anticipate at that time that we would put out our chairs in some of the private public areas so that folks could do carry out and then sit in downtown. But at this time, our chairs are being loaned to the downtown businesses. Our tables are being loaned to the downtown businesses so that they did not have to pick up that expense. So that could be a little further off. But my thought with this is that no, it's not communal at this time. It would just be an extension of their outdoor capacity. And it would be right in front of their restaurant.
Okay, because obviously some restaurants have smaller storefronts or smaller amounts of space that's actually right in front of them.
There'd be some extension of that. It wouldn't be directly in front, but it wouldn't be, there'd be a table down the street, you get your food and then the waiter would have to come 3 storefronts down to find you. So that it would be, you would know that I'm now entering in the space that belongs to COPA. And then COPA would know, okay, we have a new customer that's coming in that we need to provide service to. That's my thought.
Right. Yeah, and I'm just thinking about some of the little green spaces that we do have downtown that could be utilized. But okay, well, thank you.
And we're trying to use some of those green spaces for the outdoor dining for the individual restaurants. So if you are downtown, you'll see that Luna is in the Black Wall Street Garden. So the city has been very generous, allowing us to go out of the sidewalks and use public spaces. And they would still be available throughout the week. This is just something to allow restaurants to spread out a little bit and to allow their seating to spread out a little bit. But I do want to be clear, we are not encouraging, nor would it be allowed to go over the 50% requirement, capacity requirement that's currently in place under the governor's Safer at Home orders.
Yeah. And I'll just put in a huge plug for folks to be going and supporting our restaurants in this way. I've gone and eaten outside, and it's done very, very carefully with, folks having the QR code, and you can even order that way. And just the downtown restaurants are being really, really careful. And so I had a great experience doing it.
Thank you for that. Thanks for that update. Reverend Davis, I know there's been a lot of work with the Places of Worship group around the increasing number of homeless families. Would love to get an update on that and anything else from your roundtable.
Yes, thank you. We did have a presentation just this past week in our meeting around trying to help with the homeless population. And so we were encouraging our participants to help get the information out amongst their circles. And so DCIA had put a post up on Facebook. So we encourage people to share that, but also get the information out so that if we do know people who have properties, any property owners or landlords who might be willing to provide housing that could be utilized. There's been some conversation about maybe some places of worship that may have their own properties that they might be willing to use some space. So that's been part of the conversation as well. We also have been in some conversation, had the presentation from the DPS Foundation and the why around the learning centers. And so we've had some conversation there. We're going to have some follow up with that. There's been a lot of interest about how places of worship can participate in that effort as well. And then we're also planning the first early part of September to have another roundtable forum, rather, co-sponsored by DCIA, the clergy of Durham Can, and IMA, to kind of talk about what places of worship have been doing, what they can still do, and how to continue moving forward in as cautious as possible. So it's been, and we're still meeting, well, we're on a every other week, but we have actually met most weeks this month because the meeting for the learning centers, we felt that was important to throw one in there in the mix. So we should be back to our every couple of weeks. We've seen some increase with in our participation. Some new places of worship have started participating. And so we're hopeful that that's still a positive piece. Thank you.
Thank you so much. Excellent. Brian, are there other updates that you wanted to lift up for us from the roundtables?
Good morning, everyone. I would just say that in general, we're seeing a lot of movement towards what comes next with a lot of different industries. And so efforts like expanded outdoor dining for restaurants, as well as a program that we're piloting this weekend called Durham Delivers for a handful of restaurants and neighborhoods are very important. Unfortunately, we've heard of some fitness centers closing and letting go of their space very recently due to the ongoing state regulations. But people are trying to figure out how to do things online. People are figuring out how to try to serve youth and otherwise continue to support one another in our community. And so I think as we think about expanding the idea of getting back on the bull to, you know, so many folks in Durham who maybe haven't had the opportunity to get on the bull in the first place, I think will be really important to figure out how we support individual establishments, but our ongoing needs across the community. And so thanks everyone for the work that you're doing. These individual pieces are coming together to make big impacts, and we remain committed to trying to help serve everyone through this.
Thanks, Brian. Thanks for your continued work, really hard work on this. We really appreciate it. Are there other questions? Oh,
Katie, I have one update, and this is not necessarily an update, but more of an ask. And this relates to the education roundtable that Katie talked about at the start of the meeting. So we have sent out requests to our institution of higher education asking for representation. We're trying to tentatively pull together the first roundtable of the education roundtable the week of August 31st. So my specific ask is to the task force members, if there's any members that want to actively engage in that roundtable, please reach out to Katie or let me know that you want to be actively engaged, because we want to make sure that we have some representation from the task force that's engaged in that education roundtable. So keep that in mind as we move forward. And again, we would like to tentatively schedule the first meeting for the week of August 31st.
Thanks. Are there other questions or discussion points around the roundtables?
I would like to bring up something to the attention of the task force. This is not so much coming, well, I guess it is coming out of some of the roundtables. And it is thinking about things a little longer term. We had a great conversation with a small group of restaurant owners earlier this week. And that conversation was around the outdoor dining and the curbside delivery. But it was stated there that these are not going to save our small businesses. So I want to hone back on, you know, we're doing things to help them for the here and now, but the long term, we need to start thinking, and I say we, I don't mean like this group, but all of us need to start thinking about how do we help our small businesses, regardless of where they are. You know, let's just take the fact that I'm speaking for DDI, regardless of where they are, how we're going to help them with some of their bigger expenses. And when I pushed a little bit on what kind of expenses are you needing help on, of course, payroll. And we know all the issues around PPP and the people who did get it and the difficulty of getting that. The North Carolina Job Retention Grant came up, and that is pretty much not a non-starter for a lot of small businesses. The requirements of that are difficult at best. The fact that you can only apply for that money if you retained your employees, a lot of small businesses, they could not do that. And that you didn't get any assistance from the federal or other state programs. So that's a non-starter. But payroll was a big one, and then rent. I keep hearing, and I've heard this from March 15th when this pandemic started, that people were concerned about how they were going to pay their rent. And at some point, the collective we needs to decide how we help businesses with potential evictions. And not that I'm seeing a lot of that, but it's going to happen. And I know that there's something on the residential side that the city and the county are working on, but there needs to be a conversation about how do we help people paying commercial rent. And this concept that people who own property are rich and they should just be allowing people to not pay rent. In Durham, that's not true. In downtown, that's not true. A lot of our property owners are small businesses themselves, and they've got mortgages they need to pay, and they've got loans that they need to pay back, construction loans, renovation loans. So I just throw that out there as something as we move forward. And we have talked about it on the Recovery Task Force, a small subcommittee. So it's something we're talking about, but I thought it was important to put this on record that this is a concern. And at some point we need to look at how we bring the people who own this property, who I think would want to keep their tenants. Nobody wants to be in this market trying to find new tenants. I mean, that's not a thing that anybody wants to do. So I don't need a comment or anything from anybody, but something that we all need to keep in the back of our mind, that this is going to be an issue. And it's certainly going to be an issue if we have a second wave in the fall, based on what was presented last week with the two-prong of COVID and the flu. This could be a significant issue for us.
Yeah, that's a great point, Nicole. When we kind of talk about those three focus areas of consumer activity, and then the business survival, growth, and promotion, it's the next step for us has got to be so much more beyond identifying, placemaking and promoting. And while the Back on the Bull campaign has been tremendously helpful in assisting us with, consumer confidence, ultimately there's got to be a financial solution here for what it pertains to what it means for small business survival throughout the entire county.
Thank you for that. Really important points. Any questions on that or additional comments? I think this is vital to our discussion and our planning. Because I mean, we see it even the fitness roundtable, that it certainly has come up in the fitness roundtable around the concern over evictions. And I think this is going to be with us long term.
I'll just add, we discussed this yesterday with the Durham, our state delegation, because, again, this is always going to come down to resources. When Durham has only gotten a very small amount of CARES Act funding from the state, and compared to other counties, it's, other large, more urban counties who have a large small business sector, it's gonna come down to money and resources. How do we create a commercial rental assistance fund, just like we have one for homeowners or for renters, residential purposes? I think this is a critical need, but it's going to be, we need support again from the state and federal level on this. We just have a limited amount of local government resources. So, yes.
Wendy, in addition to helping out with rental assistance, I think helping businesses pivot, as Nicole was mentioning, helping these restaurants have outdoor dining so that they can generate revenue is extremely important. So I would recommend that some of those resources go towards helping the businesses pivot to this new normal and helping them generate revenue in this new environment, such that they're not that they're pulling themselves up by their own bootstraps, but so that they're actually developing a sustainable source of revenue that will last throughout the after this pandemic is over.
All right. Anything else on that? Again, really important.
Yeah, it is really important. And, this is a national phenomenon, of course. I mean, the large, we're seeing, reading in the Times this weekend about the way in which large corporations, many are surviving just fine, while small businesses all over the country are going out of business. I do want to say that we don't have the local resources to make this right. We don't. I don't want anybody to think, we've just got enough in our local treasuries to make this happen well. I mean, just to put it in perspective, for the $1 million that we're putting in our CDBG money into rental assistance, we think we can help about 180 families. So that's, just even in terms of the residential evictions, that's just going to be just a blip on the screen in terms of the need. So we really do need to figure out a way to get state or federal resources if we're going to be serious about attacking this. We can help, but you all know all the different ways in which local government's being pressed right now to fund all sorts of aspects of the COVID relief, and we're really struggling now. I mean, we did really, I think we've made a lot of good choices, but the requests are coming at us from all directions, and we don't have the local resources, especially given our own revenue shortfalls as local governments. And we're not, as Wendy said, we're not getting the kind of large support from the CARES Act or any other outside funding that some of the larger jurisdictions do. So we'll have to be thinking creatively, but we'll also have to be really working to get, this legislation that's in Congress now is so crucial to everything, to get local support. And as you all know, it's being held up, especially by the Senate, and passed the House, been held up by the Senate. No real good negotiations seem to be happening, but we got to have those extra resources.
Thank you. Any other updates for today?
Maticia and Katie, I apologize. I was doing double duty. We have our opening faculty and staff meeting this morning for the School of Business, but I did hear Central's name come up, and I did want to give a brief, maybe 30-second update on what's going on at Central, if that's okay.
Absolutely, please go right ahead. That would be great.
So we did have students returning to campus this week, and we don't have mandatory testing, but we do have, of course, random testing. And although I don't have the numbers for the recent tests, as of July 1st, we've had 5 students, 7 employees, and 1 subcontractor reporting positive for COVID, and that is on our website. So we do have a website that is that reports all of our cases, and we're remaining cautiously optimistic, and if necessary, we'll be prepared to pivot if need be. 63% of our courses are online, 33% are hybrid, and only 4% are pure face-to-face courses. In the School of Business, over 90% of our classes are online. And all of the classes across campus are on the Blackboard management system so that they can move to 100% online if necessary. But you know, we do have a strong sense of community and collaboration at Central, where this pandemic has made us see just how close we are as a campus. And we are approaching the situation as a learning opportunity for our students. We have a video called Protect the Nest. It's available on the website as well. And we've got in-person presentations to encourage and guide proper safety measures and student behavior. So, you know, we're using this as a learning moment, a learning opportunity for our students. But as of now, you know, with the students moving in, I think we're okay there. To my knowledge, there have been no, there hasn't been any improper behavior on campus.
Great, thank you so much. That's a great update, really helpful, and good to know the numbers, which actually, let's hope they hang in there, but that's pretty good for getting started. So thank you so much. Anything else? We are at time. I want to be sensitive to everyone's schedules. I know everyone's really busy, so thank you all so much for what you continue to do. And again, on Sunday, we'll collectively be thinking about celebrating our 100-day mark. So big milestone for this group, and look forward to seeing you back here next week.
Thank you.
Thanks, everyone.
Thank you. Have a good weekend, everyone.
Everybody.